Go and look around. Can you hear the sound of hoping for something better? Look into the crowd, see their faces now, longing for something beautiful. Every heart deserves love. Every soul should have a fighting chance. Every cry should be heard. Every life deserves a helping hand. Enough of the pain, enough of the greed, enough of this heartbreak. 'Cause we have hands to reach out. We have hope to give. We have love to live out. Yes, we have enough. We have enough to make this world go round and round. Yes, we have joy to give out. We have dreams to fulfill. We have a light to shine out. Yes, we have enough. We have enough to turn this life around. All it takes is together. No one gets left behind. We can go through whatever. We have to leave the past behind. So we light up the future for generations to come. Secure every tomorrow. Yes, the time has come. Justice and compassion. Every child provided for. Fulfill every need with action. Yes, they are worth fighting for. Itigil ang takot at gutom. Buksan ang puso, tara na tumulong. Regalo sa bawat kabataan, ang kinabukasan ng bayan. We have hands to reach out. We have hope to give. We have love to live out. Yes, we have enough. We have enough to make this world go round and round. Yes, we have joy to give out. We have dreams to fulfill. We have a light to shine out. Yes, we have enough. The time are you fired up? Bagong bayani ng kinabukasan. Step in the dark, put your lights up. Maging liwanag ng bawat kabataan. And suffering your time's up. Bagong yugtong puno ng pag-asa. Enough is enough, now rise up. Enough is enough, now rise up. We have hands to reach out. We have hope to give. We have love to live out. Yes, we have enough. We have enough to make this world go round and round. We have joy to give out. We have dreams to fulfill. We have a light to shine out. Yes, we have enough. We have enough to turn this life around. Ease up. We have hands to reach out. We have hope to give. We have love to live out. Yes, we have enough. We have enough to make this world go round and round. We have joy to give out. We have dreams to fulfill. We have a light to shine out. Yes, we have enough. We have enough to turn this life around.
Good morning, good afternoon, everyone. Welcome to our second learning exchange on social behavior change for nutrition. My name is Catherine Yee, and I serve as the Director for Advocacy and External Engagement at the South Asia and Pacific Regional Office of World Vision International. And I am delighted to be your host for for today's learning exchange. This learning exchange is part of World Vision's commitment to fostering knowledge sharing across the development sector. As members of the civil society and working in partnership with the development agencies and governments, we believe that sharing effective approaches and creating space to explore emerging trends is essential for sustaining impact and improving lives of children, of especially children that we serve. Today's virtual event is a joint initiative, once again, of World Vision, South Asia and Pacific Office, Scaling Up Nutrition Civil Society Network Asia, and of course, UNICEF, the regional office in South Asia, or UNICEF ROSA. We're very grateful for this continued collaboration and for the opportunity to learn from each other once again. In today's session, we will explore the human-centered design, or the HCD approach within the framework of social behavior change. And this is specifically on nutrition. As you have, probably a lot of you have been engaging with us since the first iteration of the learning exchange. So for this second learning exchange, we're excited to hear from our esteemed presenters from UNICEF, from World Vision Nepal, and 17 Triggers Cambodia, who will really be sharing with us great experiences that they have. So, to officially kick off this learning exchange, it is my pleasure to introduce our regional leader, Tyrion Thomas. And Tyrion Thomas is a staunch advocate for sharing or knowledge sharing, and it was really his brainchild to develop this culture of sharing in the South Asia office of World Vision. So over to you, Tyrion.
Thank you, Catherine. And once again, good morning, good afternoon, good evening, depending on where you are. A warm welcome to all of you, friends, colleagues, and peers joining us from across Asia, the Pacific, and beyond. We are indeed delighted to have you with us for the second installment of our Learning Exchange series on social behavior change for nutrition. The Asia and Pacific region faces what we call the triple burden of malnutrition. One, persistent, ongoing undernutrition. The second, widespread micronutrient deficiencies in children in particular. And three, an alarming rise, paradoxically, in obesity and being overweight. And so tackling this requires much more than just resources. It demands insight, innovation, collaboration, and continuous action. So as many of you would know, World Vision globally has launched the campaign called Enough, which is a movement to end child malnutrition and hunger. We believe that in a world where there is more than enough food for all, every child deserves access to nutritious food, which would allow them to grow, to learn, and to thrive. And just a few weeks ago, while we commemorated the World Health Day, we had launched the Enough campaign's annual report for South Asia and the Pacific. And the report, when it released, you would have seen, highlights unique and impactful initiatives from 10 countries in the region. If you have not seen it before, we would encourage you to explore it, and our team would share the link for the report in the chat. Across our operational areas, World Vision is actively engaging with governments at national, provincial, and local levels, as well as with civil society partners. Through research, through active external engagement with key stakeholders, and participation in national, regional, and global platforms, we seek to amplify the voices of children and youth and working together to bridge the crucial gaps in nutrition. And that is where we believe social behavior change comes in. SBC programs would play a very vital role in transforming nutrition outcomes. They would address long-standing cultural beliefs, increase awareness, promote sustainable practices, counter misinformation, and support the rollout of effective policies. World Vision has extensive experience in designing and implementing social behavior change programs to improve nutrition outcomes. I'll just mention a couple of them. There is the Caring for Nutrition project, which is being implemented by World Vision Papua New Guinea. And this was funded by the Australian government through the Australia NGO Cooperation Program, ANCP. And the other is the Nobo Jatra project, funded by USAID and implemented by World Vision Bangladesh. Both these have successfully promoted childcare feeding and caring practices among both caregivers and parents. And today we are excited to dive deeper into this topic by exploring lessons from the human-centered design, or the HCD approach, a method that puts people at the heart of solutions. And we are glad that we have two speakers, very experienced speakers with us, Arnab Badra from World Vision Nepal and Michael McKay from 17 Triggers in Cambodia. Their insights and experiences, I'm sure, would spark very meaningful reflection, discussion, and learning. A very special thank you to our partners, SUN-CSA and UNICEF ROSA, for their ongoing collaboration and commitment with us in this journey. Together, we are building stronger, smarter, and more people-centered interventions to hopefully reduce malnutrition in our region. Thanks again for being here. Let's get started.
Thank you very much, Chirian. Indeed, let's get started. We have 96 participants now. And hi to those in the chat. I have seen from Cambodia, from Bangladesh, but I know I also see a lot of familiar names from other countries as well. So to brief us of what is happening through these learning exchanges, as I've said, this is not just a one-time event. Let us welcome Ms. Malaya Paler, the Nutrition Advocacy Officer of SUN-CSN Asia, to give us a brief history of our first engagement and also of the coming engagement. And Malaya is also standing in for Emily Monville Oro, whom a lot of you are very familiar, the Senior Regional Advisor of Scaling Up Nutrition Movement and the Country Director of IIRR. Over to you, Malaya. Thank you.
Thank you, Ms. Kat, and good day, everyone. We are fortunate to be joined by you and by practitioners who are at the forefront of this work. And we encourage everyone to ask questions and most importantly, to reflect on how we can adapt these strategies to our own works. First, for the recap, the first regional SBC learning event was held on October 17, 2024, which brought together more than 150 participants from across the region to explore how innovative and evidence-based approaches will be implemented in our projects. This provided an enriching space for cross-learning, collaboration, and reflection on what works in creating lasting change at the community level. At the end of the session, participants engaged in 4 interactive breakout rooms, the photo voice tool, the barrier analysis, the human-centered design approach in which the participants highlighted their interest in this matter, and the positive deviance, which highlighted how identifying outliers within community. So again, the participants are interested in the human-centered design approach, which are participatory and inclusive. And this will be our topic for this session. So throughout the event, participants will gain a deeper understanding of the critical role that social behavior change plays in improving nutrition outcomes. They will explore how SBC strategies can effectively integrate into nutrition programs to influence the behaviors of our community. In addition, participants will develop an in-depth understanding of the human-centered design approach and learning how to apply this participatory user-driven method to co-create solutions with communities. Together, these insights will equip us with practical tools and frameworks to design more inclusive, responsive, and impactful nutrition interventions. In the long run, we hope that this SBC Learning Exchange will be able to strengthen knowledge and understanding of social behavioral for nutrition, equipping them with practical approaches to enhance program impact. It also serves as a platform to foster peer-to-peer learning and collaboration among practitioners across Asia and the Pacific region, and encouraging the sharing of experiences, insights, and innovations. As part of the broader learning initiative, this event contributes to a series of semi-annual virtual exchanges aimed at compiling tools, documenting best practices, surfacing challenges, and highlighting key lessons learned. All shared knowledge and resources will be curated and made accessible through the web page, which our organizers will be sent to us. Together, we are shaping a future where change is co-created with communities and one behavior, one site, and one conversation at a time. Again, thank you everyone for joining this session.
Thank you very much, Aya. Indeed, it's very important to have this platform, this space. And World Vision is very delighted to engage with SUN-CSN Asia and UNICEF ROSA because we are really expanding our reach. If you would like to take a look into the chat, we have participants from Myanmar, Indonesia, Australia, even from Paris, Pakistan. So it's really widening our reach through these learning exchanges. So now, I would like to invite everyone to the meat of our conversation. First up, we are happy to have Julia Witherson she is the nutrition specialist, Community Nutrition System Strengthening from UNICEF ROSA office. And she's an expert in maternal, infant, and young child nutrition, social behavior change, community capacity strengthening, and health system strengthening. Julia will be presenting an overview of the social behavior change communication to give the context for today's session. And then we are also very delighted to have Tasmia Bashar, social behavior change specialist from UNICEF ROSA office, also to give us the overview of the human-centered design approach. Okay, most of you have remembered Tasmia from the last learning exchange that we have, a very dynamic, vibrant group discussion there. And today, we are very honored to have both of our partners from UNICEF. So over to Tasmia and Julia.
Thank you so much, Catherine, for that lovely introduction. And it's great to be here with all of my past colleagues from Myanmar, Indonesia, Cambodia, and so forth. It is a pleasure and an honor to be here with you to really reflect on the power and the promise of social behavior change for improving nutrition outcomes in our region. Today, I'll walk you through why SBC is not just relevant, but essential in a time where budgets are shrinking, the needs are rising, and we're being asked to do more with less. Next slide, please. Our aim is simple. We want to better understand how SBC drives positive nutrition behaviors and how civil society, especially the SUN networks, is uniquely positioned to lead this work. We'll explore the why, the what, and most importantly, the how of SBC in nutrition. Next slide, please. So as Sharian mentioned, we know that the burden of malnutrition is global. 1 in 3 children are not growing well because of malnutrition. 1 in every 2 children are suffering from some sort of micronutrient deficiency. And of all of these children, half of them live here in Asia. So the triple burden of malnutrition, as Sharian mentioned, is real and is a burden that is an unfinished agenda, whilst we're having to also address the rising needs of overweight and obesity, especially among women and children in urban settings. So all of these forms of malnutrition, they coexist, and even in the same family or perhaps in the same child. So it's a complex issue that, as Sharian mentioned, cannot be addressed by supplementation alone, policies alone. It really does take a multi-sectoral and multidisciplinary approach, because we're also facing forces like globalization, climate stress, inequity, and fragile systems, factors that won't be solved simply through supplementation or awareness campaigns alone. Next slide, please. SBC is not optional. It's the smartest and most dignified investment in nutrition right now, because it's no longer nice to have. If we are truly to take a systems approach to the issues that are straining nutrition in the home, we need to look at the food system. We need to look at the health system. We need to look at the wash system. We need to look at the education system and social protection holistically, in order for us to protect the gains and the improvement outcomes for the most vulnerable in these spaces. So SBC does what policies alone cannot do. It tackles social norms. It tackles gender inequality, power dynamics that shape what people eat, how children are fed, and what services are being used. Next slide, please. So here you can see that SBC takes a multi-level approach in the socio-ecological model, from the individual to the community, to the family, to the systems level, to the institution, and then to the policy level. And that's what we need in order for us to amplify every dollar spent. And SBC does that by boosting uptake, building demand, and sustaining change across these systems. SBC really is localization in action. It puts communities in the driver's seat, as Sharian mentioned, and respects their knowledge and wisdom and strengthens their capacity to lead the change. What SUN-CSA, I love about SUN-CSA, it's dignified development, and it works. Next slide, please. So what is the behaviors, right, that we're trying to address and to improve? I'm sure all of you discussed this and explored this in the last sessions, but we really want to see what are the most impactful actions that in the most intimate and daily behaviors and practices. What a pregnant woman eats, how a newborn is breastfed, whether a caregiver continues to feed a sick child, how the food is prepared and served and stored, and who eats first, who eats last, who gets the proteins, who gets the iron-rich, foods at the table. And then lastly, whether a child with wasting is getting treatment early and getting detected early through family MUAC, interventions in the home and capacity strengthening of community health workers, and etc. These behaviors are not just influenced by information alone. The belief systems, family dynamics, as I mentioned, time constraints, market access, and structural barriers are very real. And so before we talk about nutrition strategies and nutrition programs, we really need to start first with nutrition behaviors. Next slide, please. And here we can see that unpacking the definition, in fact, SBC is a systemic, evidence-based, and it is an approach in which we use to understand and affect why people do and behave the way they do, and support the positive changes within that. So it is rooted in tested theories, frameworks, and models why people behave the way they do. And then it's also really targeting and prioritizing the positive outcomes. And lastly, it's not a tool that you use just at the beginning. It is a really start to finish approach that is embedded and woven into the fabric of your program cycle. Next slide, please. So SBC and nutrition, how does it go together? The SBC nutrition approach really is a way in which you program and implement and integrate SBC in design, implementation, and evaluation of programs. The main goal is that we keep the behavioral outcomes in the focus from start to finish. And in that, this diagram quickly shows you how a well-designed social behavior change program and approach can improve nutritional outcomes. By engaging families, individuals, communities, and decision makers through proven approaches, just a few to name, right? Social mobilization, policy and advocacy, programs can influence the key determinants of these behaviors. So that around capability, motivation, and opportunity. And when those factors align, they drive the adoption of nutrition-specific and nutrition-sensitive practices across food, health, and care sectors, and ultimately leading to improved dietary intake, better health, and stronger nutritional status. Next slide, please. SBC is much more than messaging. We know from evidence and from our own practice that SBC programming, by just increasing knowledge, raising awareness of positive behaviors, and repeating and educating communities and mothers and families, is simply not enough to improve and sustain behavior change. So for example, you probably all have worked on breastfeeding issues. A mother may be, have the strong desire and intention to exclusively breastfeed and early initiate during her birth. However, in the delivery room, you have a midwife and a doctor saying, oh, no, we need to go and weigh the baby and monitor the baby for X, Y, and Z. And then when they get home, the mother-in-law is saying the colostrum is not enough, right? Is not enough for the baby to sustain itself and grow. And then you have, all of these different messages from trusted individuals, which are conflicting some of the desires that you may have inside yourself. So for us, SBC really brings, the empathy, the co-creation, and the local knowledge to help empower these individuals in achieving those positive nutrition behaviors. And this is where human-centered design comes in. We listen first. Next slide, please. In closing, we know that SBC works, and SBC is encompassing a variety of tools. And in this very busy schematic, you can see that SBC is only one of a variety of tools and approaches that you can use in order to drive positive behavior change. But the meat of it is that SBC is at the center of our work. We need it in order for it to listen, to meet people where they are, and to give us a deeper understanding of what actually is the problem and what are the solutions that the community can lead the way on. So as you can see here, there are many different tools that we can use, but human-centered design is one that is going to help us deeply understand the people we serve, co-create the solutions, and embed empathy throughout the program cycle. So with that, I will hand it over to Tasnia, my colleague, to give you a deeper dive into human-centered design. Thank you so much.
Thank you, Julia. Dear participants, it's really great to have the honor to again come back to you on a deep dive with HCD. Next slide, please. As Julia was mentioning, HCD is not only about creating posters and tools. It's embedded in social and behavior science. And as behaviors science practitioners, we have to emphasize that science where we base our strategies. So HCD looks at how, what, and why based on behavior science and data to understand why people do what they do and how can we influence it. What do I mean by that? Next slide, please. As information is not enough, how can we go to the next level? Next slide, please. So HCD, as those of you who were in the previous section before, you'll know are built on a couple of building blocks. Who are we trying to reach? What do we think that we know? What barriers stand our way? And how could we respond? And what do we think about people? And how can we incorporate their concerns and their ideas? And most of all, how do we measure? When we are saying that we have done this really big intervention, do we really know if it has made an impact? Let me break down the blocks a little bit. Of course, for when we want to highlight who are our audience, we need to know what is the objective of that audience that we want to change. We really need to understand how do they behave. And in HCD term, we all often called it the personas. As you will might remember from the last session, we do a very interesting journey, which is called the journey map. And I often call it very fondly the line 8. We will go back to it today. Because it's a science and it's based on data, we employ different kind of assessment, rapid inquiry to understand what is it that we need to know as barriers and opportunities that exist. What is special about HCD? We try to understand what people think, and when we design the solution, can we proactively co-create with the community? This is a hard part, time-consuming, but it can work. And therefore, this is the part that gives you that whole new approach that will be sustained because you have consulted your community. And then have we made an impact? And what else do we need to tweak? That M&E part of behavior change. Next slide, please. Here's the line 8. So you will see that the left-hand side of it is about knowledge, awareness, and belief. What do I know about as a positive deviance? And what do I want to do? We know that I can influence other community members who may be low on trust and not really convinced. Let's say as a positive deviance, we have engaged with mothers and we have promoted that this mother needs to go through a breastfeeding counselor to make sure that the timely and appropriateness of breastfeeding and the complementary feeding is actually done in right time and right interval. This is us. This is the demand side. This is the individual side. But you will remember, as Julia was talking about the social ecological model, it's not only about me. It's about my friend, my peer. But then when I have gone to the point of service, maybe the counselor was not there. Yet I have actually spent money to come there, and I'm waiting patiently with my child as well. Maybe someone does come and help me. And what kind of experience do I have with that other person, the counselor who comes my way? And then it depends on our after service if I will come back. So this is the line 8. And I would say that just picture that 8 in your mind and make it in a parallel way so that you remember how HCD combines the demand side, the aspiration, but also the service provider side. Their own aspiration, their own fetting, their own incentives to bring together the program results. And this is the beauty of human-centered design approach, which brings people and the services together. Next slide, please. Very quickly, the science of it takes us through different rapid inquiry practices, and we try to understand where is our community coming from. The next slide, please. Once we get the data, and as you can see from the picture, this picture was taken from a research data collection methodology where afterwards the participants gathered to kind of try to prioritize and to see where what did they find out? For it, you can see that part of these findings were around knowledge, awareness, belief, and preparation cost. But the other part were around the service. So we synthesize and be faster. Next slide, please. I was talking about persona. Why is it important? For the mother who is not convinced, who might have behavior, we need to have a picture of that mother. We often think that we know that mother, but we need to have done the deep dive necessary. That's where the rapid assessment comes into practice. Do we know about her routine? Who do they speak to? Does she have a language barrier? Who is the decision maker in that family? Is there what economic social cluster does she come through? We can't go through one by one, we know, but we need to have a good sense of what our audience looks like. Therefore, the persona is a good practice. We also need to know what are the barriers from the health workers side. And, how are their incentives? How are their routine? Are they overworked? So therefore, by building the personas, we are better equipped to come with the strategies. Next slide, please. This is an interesting part, which I was talking about, the idea generation. The idea generation happens in HCD approach, where community and the service provider sits together after they have prioritized the key issues that needs to be addressed, and therefore co-create the solutions. Next slide, please. I have taken you through the process of different clusters of HCD approach, from the objective, the personas. We have talked about the journey. We have talked about rapid inquiry. We've talked about how we synthesize. We talked about idea generation. For the next part of our HCD journey, I will leave it to Michael and also to Arnav to talk more about the prototype and the feedback. This is where the implementation part comes in. So over to Kay. But before that, just to recap, we've talked about HCD definition, how we do the diagnosis through rapid assessment, data collection, how we co-create, and for the implementation, our colleagues will take us how they had done their implementation so that they can share some practical tips with you. Over to Kay. Thank you, everybody.
Thank you. Thank you very much, Julia and Tasmia, for really walking us through those process. And you are right, we will now be diving into how it looks like in actual practice. For those participants, if you have questions, if you have comments, or even sharing your own experience on how you have applied SBC or HCD in particular, please post it in the chat or in the Q&A portion. We will try our best to respond to them immediately. So now, let me introduce you to our third speaker, who will be sharing about the experience of Nepal Innovation Lab, or NLab. NLab was born in 2015 during the big Nepal earthquake, and it is one of the first of its kind, or it's a first of its kind in the humanitarian world to do NLab. Arnav Badav is the manager of NLab, and he has been engaged in a lot of designing HCD programs. So over to you, Arnav.
Thank you so much. So let me quickly just dive into what we're going to be sharing today. So I'm Arnav, and I'm representing the Nepal Innovation Lab. And like Catherine mentioned, we were established in 2015 after the Nepal earthquake to kind of respond to some of the key issues that were kind of coming up from, very traumatic experiences for people. And we kind of support a lot of these different things within the region and within the country offices as well, providing technical support, exploring ideas, as well as taking innovations to scale. But one of the things that we do work on is the human-centered design processes, which means we kind of have designed this entire workshop, let's say, that we have been working on in the field level. We've been bringing together community members to work on the different issues that we face within the country and even outside. So this kind of brings in a lot of different elements from design thinking toolboxes, doing sharing with Legos, as well as some elements from Shark Tank, just so it's easier to kind of get people communicating. So we call it design thinking and doing as well. And we have a little small workbook as well that we kind of use to take us through the process. And with the human-centered design process as well, kind of echoing what Tasmia shared earlier, it's about, kind of taking this jumble, this big mess, and trying to kind of come up with the different solutions that are kind of based on the issues that the people that we're targeting are facing. So that kind of starts off from the trigger point. If you see this double diamond method, then it's that empathizing sort of point. And from there, we kind of define what the problem is. We're trying to understand what the issues are that they're facing, and then we're kind of defining those a little bit further, and that's where we converge. Then that's where the key problems are. Kind of we're doing causes, we're doing root cause analyses and things, trying to figure out what's the actual issue. And from there, we can finally start working on those issues to create solutions, to kind of do brainstorming, do prototyping, doing testing, and that kind of goes in a cycle. So one of the key things that we need to mention about the human-centered design process is not that it's not a linear process. It's very in a process where you can kind of go somewhere. If you're stuck, you have to come back. So it goes around to make sure that you have the best solution coming together. And there's a couple of mindsets that we recommend as well when you're working in this process. Is to kind of let go of a lot of the prejudices or previous thinking that you have, and trying to learn things from a new perspective as well as making sure that you take failures and these different testings and things by heart, and kind of move on and learn from those as much as possible. So we've defined it in a very simple way, because we've been working with community members, is to observe. So this is to make sure that we're observing a lot of the key issues and trying to work, making sure that we're starting on a strong understanding of the key issues. Then we're kind of working towards creating solutions, going very far and wide to different solutions that might exist to different problems. You might come up with multiple solutions, and those test solutions are tested to make sure that they're kind of working, even if it's a very basic prototyping level. And these are shared so that we can get a lot of feedback from different stakeholders, different experts and such. And finally, we're trying to sell them. So kind of also goes into the processes that we work in, be it integrating it into grants or similar sort of things. And these are some glimpses of the workshop that we're doing. So like how Tasmia shared earlier, it's just all over the wall. We're both writing on posts. It's very, very extremely interactive. There's a lot of discussions going on. And people are sharing their different visions and ideas and solutions and issues that they have seen, as well as the corresponding solutions and things that you need to keep in mind with each other. And it's a very collaborative process. So in this one, we're also including people from the communities and such who are kind of facing the issues, but as well as experts in the different thematic areas that we're kind of working on. And the tools that we're kind of using are the same tools that we shared earlier. For instance, there's an empathy map, and you're kind of trying to jot down what people are seeing, what they're saying and doing, hearing, thinking, feeling, sort of things, so that we're trying to empathize with our key stakeholders, and also jotting down their key pains as well as what they would gain out of solutions. So it kind of goes like this for multiple sheets like this. So we're trying to get as much information as possible, trying to get towards understanding the problem as well as to creating effective solutions. So having done these, so I wanted to pause here as well, but it's all right. You can put some experiences that you may have for these processes in the chat box. box as well or in the Q&A if you've kind of done these before. But because we're not taking too much time, I'm going to move on. And then kind of getting into the solution that we piloted and tested out within World Vision Nepal and in other countries as well. So that's Ramailo Yatra. So when we're doing those HCD processes, the key triggers that we're kind of looking at that point was this was right after COVID, and there was a lot of lockdowns. It was a year and a half of lockdowns and constant pressure for children and such. So that we noticed that there's a lot of mental stress within children due to lockdowns. There was also a lack of educational and social awareness related to different child rights protection issues. Child marriage, child labor, corporal punishment kind of on the rise, as well as increased anxiety, which even cases of child suicides. So that was the key trigger point to say maybe we can create a solution based on that, as well as the different HCD processes that we're using. And one of the key things that we wanted to look at or consider when we're doing a solution was to make it like a gamified approach for children, as well as taking through the learning through play method. So making sure that the children are learning, but also enjoying themselves and being able to connect with each other. And because this was right after COVID and all of their classes and everything was being virtual, we wanted to make sure something that was physical and they could kind of interact with each other as a digital detox. So that's kind of where this idea of a very simple board game. So like it's just to give you context, in Nepal there's only two board games that kind of exist. One might be Ludo and the other one might be Snake and Ladder. So there's no learning whatsoever going on, and that's the extent of what people think games are. For children, but we wanted to make something that could be very effective in teaching different things, especially as they learn and they interact with each other. So because I want to share the processes that we took and showcase to you how we went through it, rather than saying, oh, this is a grand solution and just kind of giving you numbers, going through the processes. In the beginning, we're just starting with a very, very basic sketch on a whiteboard with different post-its saying, this could be here, that could be here, and putting those together to just say, okay, maybe it's just a journey from your home to somewhere, maybe there's a treasure at the end, and then you're kind of going through the communities, learning or different things. But we kind of, did a very simple hand sketch design. And that hand sketch design was then tested with our users. So initially in the offices as well, very, very basic level stuff where we just started off with an idea. So as we said, we did the observing, we did the understanding, we did the empathizing through the human-centered design workshops. Then this moved on to the prototyping and testing phases. And we took that very simple thing and then tested with children, trying to incorporate their feedback, who are the end users. For this process. And then we're trying to refine that a little bit more based on their feedback and going through different things. So as you notice, the initial sketches were just very basic hand-drawn things that we tested out with the children, and then we're trying to slowly improve on that. And this is what we ended up with. It was something called Ramailo Yatra, which means fun journey. And this was created to kind of teach children about child protection issues, because that was a key issue at that point. So it was based on the learning through play methodology, as well as the three E's of, making sure that it's entertaining for children, engaging, as well as empowering, so that it's something that they are kind of subconsciously absorbing as you kind of go through. So the game itself is very simple. You kind of have these cards. You're going from your home to your grandmother's place, which is a very socially connected activity in Nepal as well. So, usually go only for holidays and such. And then you're kind of going through the journey through your village, through the different landmarks that you might see, things like the hospital or bus stop. But each and every step, you can do a positive action or a negative action. And that's how they kind of learn, saying, oh, if there's a rubbish on the floor, you should throw it in the bin. Very simple things that you and I might consider, but for a developing child, then that kind of gets ingrained in their behaviors as well, kind of leading to that behavior, not just behavior change, but behavior setting at an early age. So it kind of goes on through all of these different processes. And, we distributed over 2,000 units all over Nepal, reaching almost all the districts that World Vision works in. And then judging by that success, we were kind of looking at how do we scale this up. So what we did is we kind of applied for an innovation challenge as well. And this is something where we said, okay, World Vision Nepal has an innovation lab, and there's also one based out of World Vision Somalia. So we kind of reached out to them saying, do you want to work together on trying to scale up this solution that we can contextualize to your needs, and then we can scale up in other regions as well, just to see how well this, behavior change based process would go through a human-centered design approach as well. So we kind of went there, did an entire human-centered design workshop. For the context that they're facing, and in a very similar vein, kind of took out a lot of information that we have based on those. So it's like a completely new game that's based for the Somali context, and similarly based on health and nutrition for Vanuatu as well. And following up on that, within Nepal itself, because we've tried it in multiple countries in different contexts, we wanted to do something because our vision, again, as Cherian mentioned right at the beginning, we've been working on the Enough campaign, and this is a very right sort of time for us to move on to this sector as well. And, taking ideas that we have already had, saying, okay, it's a game that kind of works for children to kind of communicate with each other, to learn from each other, as well as teach each other. Because it's based on information that we're kind of coming in, and as we are based on showing you processes of this of what we did for human-centered design as well as social behavior change based on this game, we moved on to working on a health and nutrition based scale up. So in this one, it's not complete, so we just wanted to show you the processes as well. The game itself, it's not going to be just saying, oh, you should eat this, you shouldn't eat that, and then be done with it. What we wanted to do was make it like a challenge, but also give them agency to the children, where they are not just saying, this is good or this is bad, but then they have the opportunity to build a healthy diet for themselves, be it even in being in like a game format, but we hope will kind of translate into real life down the line, as you're kind of learning this information at a young age. So the way it works is, so this is again very, very basic stuff that we've been working on. So the way it kind of works that we've said is there's multiple food groups that the children need to be aware of. And also because we're aligning with some of the government policies, we've kind of divided those into the different, let's say, 5 categories. And you have different sort of foods in different categories. So for instance, if a food is just based mostly on carbohydrates, let's say rice, then it's going to say, okay, this is the carbohydrate section, and then you have proteins and you have vitamins and all of these different things that kind of come together, and you are going through a journey through this land of food, let's say. And as you're going through, you're picking up different cards, and those cards, let's say, you have, let's say a card says 1 bowl of rice, then you have 1 bowl of lentils, but also let's say a bowl of fruits, and then you're kind of saying, okay, this is a card that I need, but then let's say you have a card, let's just say sweets, then that's a card that you don't need, and you're kind of building together, and you get to 100 points, so let's say 100%. So then you have 10 cards that are coming together to say, okay, so in my healthy diet, I have in a full day, I'm having maybe 1 bowl of rice, but also 1 plate of rotis or chapatis, like I would say, and then like all of the different food groups that are coming together as well. And in the middle, we're incorporating information that's kind of going through, saying things like the importance of exercise, importance of hydration, and as well as these other information that's kind of coming through. And it kind of comes up like this, where you have different cards and different statistics, where children are kind of very engaged in learning from these different things as well, but also making sure that they are interacting with each other and building a healthy diet for themselves. Okay, so I'm going to end right there because it's been a long journey as well, where we're saying it's a different process of learning from these different tools. We've been going through and working with the different children that we've been working with, as well as making sure that their feedback is incorporated, making sure that the children that we're working for, that World Vision works for, are at the center of the solutions that we're working in. And this is really targeted towards them and it's not supposed to be a be all and end all sort of solution saying, if you play this, then you'll be an expert in this category. Is to make sure that when we're talking about social behavior change and behavior setting, is to make sure that that base is established right at the beginning at an early age. And then from then on, all of the other programs and things that we work on is building up on that, making sure that then it has a longer term effective change. Thank you so much. And if you have any questions, please, in the Q&A section, we'll be happy to answer them as we kind of go through. Thank you.
Thank you very much, Arnav. And indeed, there are lots of questions in the Q&A. Please visit that and try to respond. There are also questions in the chat. Kindly respond on them as well. And thank you for sharing that. I also had the privilege of using that game, board game with our children. And it was really a lot of insights coming from them when they were doing it as well. Now we will hear from Michael McKay, the country director of 17 Triggers in Cambodia. 17 Triggers develops tailored service packages to help organizations achieve behavior change at a fast scale. 17 Triggers has its presence both in Asia and in Africa. Michael is also the co-founder of BB Plus Bongo, an award-winning social enterprise that is scaled internationally, proving that businesses can be a force for good. So thank you so much, Michael, and over to you.
Thanks. What a great introduction. Thank you very much. Okay. I am going to share my screen right away here. Jody, our partner from WFP, is not on the call today, but I'm happy to be sharing on behalf of both of us. So we did work with World Food Program to create the Battle for Healthy Diets. It's a gamified school-based nutrition campaign. We've had previous speakers already talk about the HCD process. So I'm going to get right into some of the behavioral lens of things, and then actually what the sort of prototype, the pilot looks like, and kind of what happens after the HCD process gets to that level. So first, what's the big problem? As people touched on earlier on this, nutrition crisis across the world in multiple countries, certainly in Cambodia. The triple burden of nutrition, all the way from nutrient deficiencies to obesity. World Food Program did a study in which 60% of children ate a fruit yesterday, but 58% had also had a sugary drink, and 56% ate sweets in the last 24 hours. And from 2010 to 2016, there was been a 55% increase in overweight children in Cambodia, which is staggering when we look at the malnutrition rates as well. So we had a big task in front of us. How might we help children develop healthier food habits? So food habit is a behavior. So in order to help change behaviors, we have to have a way to analyze what are the behaviors that are happening and what are the barriers and enablers that can help change behaviors. So many of you are practitioners, so you probably use different models for behavior change. We use a very simple one because we work with low literacy populations, and we want to make sure that behavior change is simple for people to understand. So we use a very simple metaphor called the elephant, the rider, and the path. Now, basically what this is a metaphor that says inside of all of us, there is an elephant. And the elephant represents our emotions, what we feel, what we're motivated by. And like our emotion, like an elephant, our emotions are extremely powerful. So when we are extremely motivated for something, we are almost unstoppable. Any of us who've had a goal and we are super excited about it, almost nothing can stop us, right? This is also the part of us that loves instant gratification. If you have a Fitbit that gives you a little applause when you reach your steps, this is the part of us that loves that, right? This is also the part of ourselves, though, that is very stubborn. If we do not want to do something, we are very unlikely to do it. This is also like an elephant. Our emotions are easily manipulated. We can be very easy to be scared about change if something seems too hard. It's very easy for our emotions to make us afraid and move away from things. So this is one part of us. And also like elephants, we are very social. Our emotions and our motivations can be influenced by the people around us. So it's very important to understand how our motivations are working in behaviors. Then inside of all of us is the rider. And this little rider is perched on top of an elephant. And this is the part of us that thinks that we are in charge. This person on top of our emotions thinks that I'm going to be able to direct this big, massive animal to wherever I want to go. And if you've tried to pull an elephant before, you realize that's pretty much impossible to do. But this is also the part of our brain that's responsible for rational thinking. This is the part of us that's really good at setting goals and making a plan for getting us to those things, right? We believe we're in charge and we think we can get there, right? This is also the part of us, though, that's really good at finding problems. It's the part of us that can find the reasons why something's not going to work. It hasn't worked before, it's not going to work now. And it's also the part of us that can suffer from analysis paralysis. If you've ever tried to select something from Netflix and 15 minutes later you still haven't watched anything, that's part of our brain. So the elephant and the rider are always a little bit at odds, trying to make decisions on behaviors. And they have this combative relationship on the path. And the path is our environment. And our environment means our physical environment, our social environment, and the cultural context that we're living in, right? The easier the path is, the less motivation is required. So if I want to drink 2 liters of water a day, it's much easier to do if the bottle's sitting right beside me than if I have to go across the room to get it, right? We also have herd mentalities, right? Other speakers have mentioned social norms, right? We're a social community, right? So when our herd is acting in a certain way, it can enforce good behaviors or it can also prevent good behaviors, right? So we have to make decisions and behaviors in the context of our environment. So coming back to our Cambodian situation, right? Oh, my screen seems, so to change behaviors, we need to do 3 things. First, we need to direct the rider. So first of all, what is the behavior we want our kids to do, right? If we don't give them a specific thing to do, it's going to be very hard to do, right? Then we have to motivate their elephant. So now that they know what they're supposed to do, how do we get them excited to do it? Because again, if we're not motivated, we're not going to do it. And then lastly, how do we shape the path? So how do we make that good behavior that we want them to do ridiculously easy for them to do? So with this in mind, we have a big question. So we want Cambodian school children to choose and eat healthy snacks at school. Snacking at school is a big, popular, common thing to do in Cambodia. And this is an area that we, from our HCD process, felt that we could really make an influence on through social behavior change. So first we had to look at some of the behavioral barriers we had to overcome to come to change. So some of the rider barriers, so this is that knowledge center, right? First, kids really didn't know what makes something unhealthy. They didn't really know about sugar, salt, fat, oil, on what constitutes something as unhealthy, right? While they've heard of healthy food, they really don't understand the benefits. They don't know what that food does in their body and why it's good for their brain or good for their muscles, right? They also have a lot of mixed messages from advertising, right? Things like energy drinks say things like it has vitamins B6 and B12. I mean, vitamins are good, right? This must be healthy, right? And then there's also a prevailing idea that homemade is always healthy, right? And we know for certain that that's not true in a lot of these homes and even in our own homes, right? We don't always make healthy food choices. So these are some just knowledge barriers that are overcoming, but there's also some opportunities. Kids are actually quite curious. So on the knowledge side, even though they didn't know a lot about nutrition, they were quite interested and willing to learn. So this was a good sign for us in our campaign development. So next we had to look at the elephant. Where was their motivation? And there were some big elephant barriers we had to tackle. The first, as you can imagine, was unhealthy snacks just taste good, right? They taste much better than vegetables do, right? So a big barrier to overcome. Another big barrier that was maybe a bit surprising was how much children worried about not belonging. The sense of feeling normal, especially around food, because snacking was kind of social norm at school, is they really wanted to be doing whatever their friends were doing, right? So that worry was definitely something we wanted to be cognizant of. But there was actually some really interesting motivational opportunities as well. So when we looked at the enabler side from behaviors, again, taste is something that can drive children, right? And this can be a bad thing or it can be a good thing. It's a primary motivation. And one of the things we found was children love fruit. Fruit tastes good. And when it's available, often they will make that choice to have fruit. They also like to try new things. Unlike some of us who are a little bit older and set in our ways, they're happy to try new things, right? So if something is presented to them, they'd be motivated to give it a try. And then, like taste, influenced by their peers can be a positive or negative thing. So how might we use social pressure in a positive way to enable good behaviors? So then lastly, we had to look at the path, the environment. How hard it is going to be for them to eat healthy, right? So some of the big barriers in the way was first at home. At home, health and nutrition is not well known. They usually eat the same meals. And as we've discussed in previous with speakers, not always nutritionally diverse or adequate. Caregivers also don't provide snacks for kids to go to school. Certainly not healthy snacks. Instead, what they're given is money, Even the poorest households give their children a few hundred real to purchase snacks. You can buy something for 500 real. And so kids are sometimes given as much as 2,000 real, which means they can buy up to 4 snacks sometimes per day. And as you can imagine, there are plenty of unhealthy snacks available on or near school grounds for kids to buy. So definitely some big path barriers, but again, there's also some opportunities that we saw. So one of them was access to fruits and vegetables at home. Most people have home gardens, even if they don't always utilize them effectively. Most kids do have access to fruits and vegetables at home. And as we mentioned, they will select fruit if it's available and if it's offered to them as a snack. Caregivers will actually often cater to children's requests quite easily. They are very eager to please their children. They want their children to be happy. So if their child asks for something specific, they will do their best to cater to it. And then similarly as well, vendors, being good business people, cater to the demands of their customers. So if the children buying snacks from them started to ask for something different, vendors do their best to meet their customer demands. So this gave us a really good lens of like, where are the areas that we can have an intervention and how might we have the most effective behavior change? So how might we engage children as change agents and shift the social norms to healthy snacking at schools? So our solution, as I've kind of alluded to, it was the Battle for Healthy Diets. This was a 3-month gamified nutrition program where kids ate healthy foods to defeat the bad foods. Here's how it worked. So first, at an individual level, students were given a booklet with a 3-month tracker. So they had a tracker for each month of the game, right? And in that tracker, they had to try to eat 5 different colors, representing different fruits and vegetables, right? If over 2 weeks they ate all 5 colors, then they got one of the Freshy Cutie stickers, right? So little rewards for eating all of their fruits and vegetables. In their booklet, they also received this guide on what are the different types of colors that counted for fruits and vegetables. Notably, white was mostly just the egg was the only thing that counted towards their tracking. Now, if they were able to eat all 5 and they got their Freshy Cutie sticker, their name went up on the board. This was the class chart. Classes worked together to defeat each month a different bad guy, a different bad food, right? So if the child, again, finished their individual tasks, their name went up on the board, but the class would only defeat the bad snack if 70% of students completed their individual missions. So that peer pressure to make sure that we were going to complete this together and we were going to defeat together was high in this intervention. Now, we also recognize that some households may not have the money or the means to provide a diverse diet. So one of the incentives was to have students help each other. So there was a sharing card that was given if students shared either their snacks or helped in other ways for their friends to be able to complete their missions. And they got the victory card if they completed all 3 missions. But it didn't stop there. So at the class level, you had to defeat the snack. But then if the class defeated the snack, then they went up on the school board. And the school worked together then to defeat the biggest, baddest food, the big donuts. And again, 70% of classes had to finish each of the monthly missions to eventually defeat the big final boss, if you will. Every class that achieved those missions received the champion certificate from the principal and made for a very exciting intervention. So briefly on the implementation, so very exciting. We really had a good time with this, with WFP implementing this. So the implementation was modest, but realistic. So we started with 86 primary schools across 4 provinces. So big enough, but small enough to get some indicators of how it was working. We did a cascade training of teachers to make sure implementation would go well at the school level. And overall, about 18,000 students were engaged in this particular intervention. So maybe you're wondering, how did it work? Certainly there were signals of success. And as the HCD process indicates, there's always room for improvement. So let's talk a little bit about that. So the first indicator of success was that children were in fact driving demand. So they were asking their caregivers for particular colors in order to complete their missions. And these were not out of the world requests. Sometimes it was buying something different, but sometimes it was just peeling a carrot in order for them to check the orange box. So we definitely saw students moving demand forward in this case. In terms of engagement and behavior change, more than 80% of students completed all 3 monthly missions, which is a great statistic, which meant more than 14,000 students were consuming, at least over those 3 months, a more diverse, colorful, and nutritious diet. And 60% of schools reported that caregivers and vendors were involved in helping their children complete their mission. So again, when we think about that path and some of those barriers, vendors can be helping or hindering the behavior. And at least in 60% of the cases, vendors were actively trying to help students reach their missions. Some of the school-based respondents, so from teachers and principals, and this is more anecdotal, like the observation of change in schools' diets is definitely recognizing over the course of the intervention, much more healthy food being consumed versus unhealthy food, which is a great signal of success. And just a couple of key success factors before we get to some of the areas of improvement. So one factor to consider, we did do this with World Food Program and in the schools where they have school food program. So that means there is a school meal, at least one, that is provided. So we did see schools on their own volition adapt their menus to help students complete their mission, which is great. Incentive stickers and the idea of defeating unhealthy snacks were especially motivating for kids. We did do a test where there was no incentives, and it did work, but not to the same level that incentive stickers. Without the incentive, kids do it as an obedience thing. This one, there was more self-motivated. And maybe most importantly on this one was that this was actually a very cost-effective solution. In a lot of these areas where we expect governments to take over or other CSOs to take over or schools themselves, this is only about $1, just over $1 per student, at least in this early trial. But there were some areas for improvement. Despite our best efforts, the schools said that low caregiver engagement did make it harder for kids to complete their missions. So again, some caregivers very involved, other caregivers not as involved. And likewise, we tried as best we could to make sure it was as inclusive as possible, but still about 10% of schools said families just couldn't afford to provide the variety. And even with the sharing sticker, some students not able to complete their missions based on economics. And vendors still continued to sell unhealthy products. And of course, that meant children continued to purchase them. There are policies in Cambodia about selling unhealthy snacks, although the enforcement level is not quite there yet. And then only about half of the schools found the intervention to be easy to implement. And as we mentioned with barriers, right, if it's not going to be easy to do, it's going to be very hard to be sustained and to scale. So just lastly, the last section here is like, this was a very much a working prototype and a pilot. Like it was a localized group to test to see how viable this could be. So now we're at the stage of exploring what does the next iteration and scale up look like. So the first thing would be to go back and co-create a little bit more to improve the implementation. So one thing is to make sure we have a more rigorous impact evaluation. While we have early signals of success, we really need to find that concrete data to make sure that this can scale, not just in Cambodia, potentially regionally. Right? Caregivers need a little bit more information and guidance. We didn't have any direct tools specifically for caregivers, so we'd want to look at how we could engage them more deliberately. Again, teachers, only half the schools found it easy. They didn't necessarily find it difficult, but as soon as we have resistance in something like this, we want to make sure that it's going to be as easy as possible. So we definitely have to look at ongoing training and support. And then lastly, working with the government to, again, enforce those school policies. If we make unhealthy snacks hard to access, especially on the school grounds or nearby, makes it a lot easier to enable those healthy habits. The other thing we're looking at too is how do we expand to other channels, specifically digital. If we can get into a digital platform, suddenly the ability to reach different caregivers, schools, vendors can be much more widespread. It can enable things like school versus school competitions. So we did it at the individual level to the school level, but now it could be very interesting to have school versus school or province versus province. Mobile games and video content, certainly the concept lends itself well to that type of thing, which would allow caregivers to interact and engage with their children at a different level. And then there's really great technologies we're not leveraging, things like augmented reality, where being out in the market, caregivers can be scanning what are the nutritional facts of particular fruits and vegetables, or where kids too can see those things live. So very exciting intervention for us. We really enjoyed it. We're really looking forward to the next phase. And so you happen to be interested in helping us scale this, feel free to reach out to me or to Jody from WFP. And yeah, I'd like to thank you very much for hearing our story today. It was great to share and great to be a part of this.
Thank you. Thank you very much, Michael. As you can see, the chat box and the Q&A button is really on fire with a lot of questions, comments, and also some of our participants are sharing their own experiences in doing or implementing SBC or HCD. So I would like to go into our Q&A. And if I can request all our 4 speakers to be up on stage. I know that most of the questions have already been responded to in the Q&A button below there. So please continue to respond on that. But probably I would be asking some of our participants if there are any questions in the Q&A button or application that you see is very interesting and would like to expand on that more. I'm opening the floor for that. And then probably, Michael, I will be asking you a little bit about, because you touched this in your presentation, on the importance of also working around policy, making sure that the policy on the access of unhealthy food is also being worked out with the government. So probably an expansion on that, on how we can work on that in side by side with SBC, and then the cost effectiveness, because there's a lot of comments there that it's really interesting, but how much it costs? Can it be implemented in a low resource setting? So yeah, over to probably Tasmia. Can I go with you? Is there any question in the Q&A that you really find it interesting and would like to expand more?
We talked a lot about HCD and how it can be used for nutrition, but there was quite an interesting question on how it can impact the climate change. So I've actually broken it down. I've given some bullets, and basically there are 4 areas. It comes from, the data, the citizen participation, prioritizing, and co-creation. So that was a very interesting question, which was nutrition, but how would that also impact climate change? And for HCD and cost, how costly it is, I would actually also, so SBC is like any other program intervention, it needs to be funded. We can't be going on over and over again with poster printing, on which we had spent millions. Let's bring the science to it, and with the program approach that was explained today by Arnav, by Michael, by myself, and Julia, let's actually put that under, when we write the program proposal, under as a strategy, as a program that will need funding and not be shy about it, and step back to say, but how much will it cost? We've already done that through printings. So let's do it in a scientific way. That would be my submission. Thank you.
Thank you. Anyone else before I go to the next question? I know Michael is very busy typing responses to the Q&A, but I'll go to you next, Michael. On making sure that the policies also are supportive of this SBC approach interventions that we are doing.
Yeah, policy is really, I think Julia might have touched on it at the beginning. I made a note of it because I think that's kind of where social behavior change has such an important role, and especially in these developing contexts where the government can't necessarily be relied on to either have those policies or enforce those policies. So it tends to be more working with local governments or local actors to enforce maybe what the government might normally enforce. So I think in my experience so far, I don't think we can rely on policy to be the maker of change, right? I mean, we do a lot of work with UNICEF, and one of the best things about working with UNICEF is how closely they work with the government to be working on the policy level in tandem with some of these programs. So I mean, in the ideal world, yeah, policy is what's helping shape those boundaries at the local level. But in absence of that, I don't think we can use that as an excuse to not create change, because I think there are local change makers and social norms that can be shifted in absence of good policy.
All right. Thank you very much. Yes, Julia, I'll give you time to respond. But the next question that I will be asking will be on the M&E, because there's also a lot of questions being asked. How are you monitoring even the sustaining the behavior of the children after the intervention? But before the M&E, yes, Julia, on the policies, go ahead.
I just wanted to speak to Michael's point, because I think that's where, my point was policy alone, right? We know policy is critical, but in Cambodia, where a lot of my experience is based, right? Also, you see a lot of policies in place, but the enforcement and the implementation where the policies, actually hit the ground, as you all know. And I think this is where, SBC really comes into play. For nutrition and IYCF, I'll speak in that. There's a lot of great guidance and policies in place, right? Which are all evidence-based, scientific, you know what I mean? Really rigorous. However, when you get to the ground and to the families, right? A mother is not able to early initiate because, right, the policy is there. So I think that's where we come in, right? To really support and empower and work and accompany these individuals on both sides, right? Health provider side and on the user beneficiary side, in order to feel that this is something that they can actually achieve. Thanks, Michael, for bringing that up.
Thank you. Thank you very much, Michael and Julia. And then now to the M&E. I saw Arnav responding to the chat or the Q&A there. But Arnav, can you, I'm giving you the floor to also share your experience on how M&E and even, assessing the sustainability of this in the board game.
Thanks so much. So yeah, with the M&E perspective, that's something that we have been, let's say, because we're supporting some of the innovation processes within the region as well. That's something that we've, discussed a lot, saying how do we actually test innovation solutions? Because one of the key things that we've kind of always noticed is what are you trying to achieve is extremely important. So like I mentioned earlier as well, with the board game itself, it's not a be all and end all sort of solution where you were saying children will be expert and their behaviors will be changed immediately. What we're only trying to gauge is, so what we did is we did A/B testing. What we did is we made sure that the guardians as well as the teachers were reporting changes in behavior of the children as well as we had the children from different schools where the implementation happened, as well as the implementation did not exist, to kind of say what is the difference from in the same age group where the board game children played the board game. And we had this implementation plan saying, in the month or so, they had to play the game 4 times at least to make sure that they're kind of getting all of the information and they're kind of retaining that and they can kind of turn that into actionable behaviors. So that's kind of like the processes as well. And we noticed like there was a sharp rise in children reporting that they learned new things about some of the different issues that they might not have considered before. And then they're also reported that the children and guardian reported that things like washing their hands before mealtime and after playing has gone up as well, and like things like asking for soap and sort of things as well. So yeah, so that's the kind of the things that we've kind of noticed on M&E. And there's this another question that I also kind of answered about the HCD process in the chat just now as well, about if you need to do that process again every time you need to change context. So yeah, one of the key things that we always mention to people is saying that context is key, always. And as soon as you start changing a lot of things about where we're working, things like languages and culture, then even minor differences can have dramatically lower impact on some of the solutions that we're working on. So for instance, for the Nepal one, when we worked on it, we tried to translate it to, for instance, there was a question about if we worked in the Madhya province, and then the local languages that we're working in was called Bajika. But then we weren't able to translate at that stage. But then because we weren't able to do it, we noticed that the game was still in Nepali and that was implemented as is. We noticed that it was a little bit lower uptake because it wasn't in their local language, even if the content was the same. So yeah, things like that are extremely important. So every time we would say change the context dramatically, you'd need to run through that process again just to make sure that you're being as effective and targeted as possible. Thanks.
Thank you very
Can
much,
I
Arnav. Yes, go
Can
ahead,
I
Tasmia.
just compliment what Arnav had said? Very practical examples. If you remember the lying eight, the loop actually goes into getting the new information of the prototype and to see how we are actually using the new information to make the change. So that data is very important. Therefore, the need for rapid inquiry to happen quite frequently. And it's not really, it doesn't take a lot of funds to do that, because as part of our routine monitoring, we already collect that data. The important is we have the data, what are we doing with that data? So if we are finding out that the community for last 6 months is saying change the time of the session, and we are doing the time of the session exactly the same time without expanding it, simple tweaks that can happen. So therefore, these kind of community monitoring needs to be actionable and actioned on. We actually have data, but it's important to see how we are using that data to close that loop over and over again, what we are finding out. So I'm sure we are doing it, but we just need to push ourselves to do more of it. Thank you. Anna, thank you for that experience. And also, Michael, you had also mentioned how you're taking the current data and going to the next phase. So a little bit clue on that as well, what they had spoke on M&E earlier.
Thank you very much. I know this is a very interesting conversation. Unfortunately, we don't have much time, but there's request that if you can share your email addresses to our participants, because I believe that they would want to reach out to you for more questions or even for you to share resources, particularly the games and then all of those. So again, thank you very much to our speakers, Julia, Tasmia, Arnav, Michael. Thank you for sharing your experiences, your expertise with us. So now we move to the next. As we mentioned, we will be sharing all the presentations with you, including these links to all the resources that we have gathered or collected so far. I believe that this will be very helpful to you. And now, as we said, Malaya mentioned early in the call that this will not be the last of our learning exchanges, right? So I would like to welcome Graina, our health and nutrition advisor from World Vision International in South Asia Pacific, to do a poll, because this will help us plan and prepare for the next learning exchange. So please, Graina, if you would be happy to do the poll for us. Thank you.
Yeah. Thank you, Kath, and very happy to meet you all through this call. And as we are preparing for the next series of this learning exchange, I would like to collect what are your learning aspirations. Very happy to see that there is overwhelming responses, participation in today's learning exchange. But we are happy to host these kinds of learning exchanges for the future. So I will be conducting a short poll to know your learning aspirations, also to understand the challenges that you are facing in implementing SBC for nutrition. Also, let us know what additional support or resources would be required to implement them. And please feel free to provide your recommendations in the chat or in the Q&A so that we will be compiling them and preparing for the next phase. So let me open the poll. So please respond to them. I hope you can see the poll on the screen. Yes. So can you please respond to these 4 questions? So the first question is, which areas of social behavior change for nutrition do you require more training? Please select multiple options as well. We are happy to look into them. So this is the first question. I hope everyone can see it on your screen. Yes, people have started responding. Yeah, so that was the first question. Please take some time to look into this so that we can prepare the session for the next one. The second question here is, what specific topics within social behavior change for nutrition are you most interested? So today we came through a wide range of issues. We discussed a lot about policy, and we looked at the issues that are persistent at the household level. So we looked into all these. Then we have the third question. What challenges do you face in implementing social behavior change for nutrition? So we have only 7 people who are responding to this poll. I request all the participants to please respond to these questions because this is going to shape our preparation for the next one. The questions are self-explanatory. What additional support or resources would help you in your work related to SBC for nutrition? So please let us know. And also from the previous learning exchange, photo voice was one of the requests. We will be also looking into the photo voice, the findings from the photo voice study, which is done in Indonesia by World Vision Indonesia. We will try to include that in the upcoming learning exchange, and in addition, include the learnings from here. Thank you. But still we have only, people are slowly responding. Please respond. So we have 55, 54. Yeah, the numbers are increasing. Thank you for taking your time, please. Yeah, we still have a few more minutes before we close. Yeah, so 58 people. Yeah, still going on. Thank you. Those who have not yet responded, please do respond. Maybe another minute. Yeah, by the time people are responding to this question, to these questions, let me also thank Ate Emily for joining us today morning. She was not able to be with us. But yeah, we are thankful for her to join this learning exchange. So I will be handing this over to her. I will not end the poll right now. I will give some time for people to continue their responses. I still have the screen open. So please provide your responses here, and considering the time, let me also say that, the responses are still coming in. So I'm not able to conclude and say that this will be the future topic for our discussion, but this will be communicated through the follow-up email. So please watch out for a communication with all the responses to our questions, and what will be our focus for the next learning exchange. So now I hand it over to Emily for the wrap-up and closing remarks. Thank you.
Yes, thank you very much, Grana, and hello to everyone. Such really an interesting and productive discussion, and I learned and enjoyed a lot, and I hope you do too. But I'd like to provide a short summary of what we have had. I really enjoy the speakers, sharing. Julia emphasized the importance of human-centered approach, the need for multi-sectoral and multidisciplinary approach, which really aligns with the values and principles of the Scaling Up Nutrition movement. And I love how Julia described social behavioral change as systemic, evidence-based, affecting positive outcomes and an approach to programming. Meanwhile, Tasmia deep dive into the human-centered approach. I think a lot of you have been asking about, the details of the human-centered approach. So the building blocks, as long as the processes and steps was discussed by Tasmia, emphasizing listening is very important, listening to the communities, what their issues are, and where they are coming from, and the importance of synthesis to understand the root causes of the problem, which feeds into the idea generation where brainstorming and co-designing of solutions happens. I love the sharing of Arnav on the double diamond method, where he further discussed about how empathizing happens, the defining of solutions, the prototyping, as well as the implementation of the idea. And he emphasized that it's not really a linear process. I know that there is a lot to digest. There are a lot of information that you have right now, but rest assured that we will be sharing with you the information so you can get back to those information and reflect on how you yourself make use of this framework and processes in your own work. I think it's also useful to have all the cases that has been presented. Arnav talked about the post-COVID case and the gamification. I think this is really what we need right now, because children, you know how they are. My kids, they never outgrow their love for games. And we should maximize, the potential of games in terms of teaching children, as well as really promoting healthy behaviors. So the games like the Ramaylo Yatra, and of course the healthy battle for healthy diets, the gamified school-based nutrition SBC campaign that was shared by Michael. I thought everyone really loved it. The metaphor, the elephant, the rider, and the path. And it's really very interesting how this has generated positive impact in schools. So if you are interested to scale it, as what Michael had mentioned, he had shared some of the lessons that they have learned and areas for improvement. So feel free to get in touch with us or get in touch with Michael. So I hope that we have responded to your request, to the gaps, learning gaps that you have shared with us, and rest assured that with this partnership with World Vision, as well as the Scaling Up Nutrition Movement Civil Society Network for Asia, we will continue to bring you some of this learning exchange and learning events where the intention is really to improve how we deliver our community services. Over to you, Kat and Grana.
Thank you, everyone. I hope that this has been a useful 1 hour to everybody. And please expect more communication coming from us in terms of the resources that we will be sharing, and most especially to the next Learning Exchange, or the Learning Exchange 3 on SBC. Again, thank you, everyone. Have a good day. Appreciate your time. Bye.